You will not find that at your standard doctor. Your standard doctor doesn't care. Your standard doctor is just going to give you a medication because it's quicker. It's just so much easier than trying to determine lifestyle factors that are going to impact somebody's gut. It's easier to just give you medication. We'll do surgery in 5 years when your stomach is completely a mess. All right, everybody, welcome to another episode of the Jacque Show. So I figured, since I got in trouble on YouTube last week for going off on a little rant here, that I'd get back to basics and start teaching more about the digestive tract. This is where the series is going. This is where it's headed. And this is honestly one of my biggest passions, is speaking of this particular portion of the GI tract. Now, for those of you who do not know, I'm going to keep this super basic here. When we're talking about the GI tract, the digestion starts in your mouth. So it starts in the oral cavity. We're going to do a separate podcast on that. But when we put food in our mouth, our body starts to produce more. I'm salivating right now thinking about it. But we start to produce some enzymes that as we're chewing, those muscles of mastication start breaking down the food. And then we drop it down the esophagus and it goes down into our stomach. This is where we are going to start today. Now, the stomach is massively overtreated and undiagnosed or diagnosed improperly. The stomach is also super near and dear to my heart. In the past, I have had horrible stomach issues. You know, growing up, I had really bad acid reflux. I was on Prilosec. I was trying to take absolutely everything I could to help and handle my gut. And it led to skin issues, led to acne, it led to massive anxiety, horrible social anxiety. And it basically turned me into a recluse because I just hid away from everybody because I didn't know what was going on. And through high school, as I was working on myself, because I got bullied, so I got into weightlifting, got into eating way too much protein, building my physique, going from freshman year of high school at, I think it was like 98 pounds. And then like leaving senior year, I was 198 pounds and grew a couple inches. But the thing that I didn't know was that the lifestyle habits that I was creating at that time were not healthy and they weren't necessarily sustainable, right? So these things that we're going to talk about from a stomach standpoint, there are certain infections that will typically pick up when we are children. And sometimes they will go subclinical, which is where they don't express symptoms or not knowledgeable symptoms where we're aware of what's causing it. So I had all of these symptoms and all of these things that were taking place. I tried treating them in every way I possibly could. My mom tried helping me with changing the diet. My dad was trying to help me with it, and I couldn't really find any answers. And so I had horrible allergies. I was taking antihistamines every single day, especially back in Pittsburgh. Pollen was horrible. I remember mowing the grass. My eyes are watering. And you guys are probably like, what? We're talking about the stomach. Why are you talking about all these things? You will see, right? Because everything that happens within the body is so intimately connected. And if we don't understand that, then we will fail to fully treat you as a person, as a full-on individual. And this is where doctors and ologists get things screwed up, is that they try to break off portions of you and pretend that that's the problem, right? No, it's right here. You go to a cardiologist, they're going to treat the heart, right? If you go to an endocrinologist, they're going to try to give you hormones. If you go to a dentist, you're going to get some dental work done, right? Like you're going to these people, and no, a dentist's not an ologist, but you go to these people to get these answers, and you just keep coming back with the same thing, and you're not getting the true underlying cause of the problem. You're just getting something to continuously mask the symptom of the problem. As I was growing, as I was developing, as I was learning, I was going through undergraduate, and I went into chiropractic school and still hadn't found the answer to my gut yet. I was getting adjusted. I was trying to eat healthy. I did bodybuilding competitions. I had horrible irritable bowel. And I'm like, oh, for the love of God. I even got into what I'm doing today. And the organization I was with before was Love Drunk with some other company. And I kept testing myself. And I'm like, I can't find any answers. So I finally found my GI map, which is what I use today. And it found a positive infection for H. pylori, right? And we'll talk about this particular infection because I see it all too often. And from what the statistics show now, about 50% of the US population has H. pylori, but only about 20% of us express symptoms, which makes it dangerous. It's silent but deadly. So let's just talk about the stomach. We'll move on from there, and then we'll get into the infection piece of this, okay? So when it comes to the stomach, it's very rare that we actually have an issue where there's too much stomach acid. Okay, I'm going to say it again. It's very rare that we have an issue with too much stomach acid. So these things where acid reflux may take in, we may have these instances where our body is overproducing. Maybe rare cases, your body just overproduces stomach acid. Your parietal cells are just like pushing out a ton of stomach acid, right? But more often than not, it's not the case, right? Because we're taught, oh, we have acid reflux, take Tums, take something to suppress the acid, 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 suppress the acid. And then we take stuff that we don't know suppresses the acid, and we suppress the acid, and we suppress the acid. You understand that I'm not crazy when I start going through, hey, what causes stomach issues? What causes low stomach acid? You're probably doing a lot of it right now, right? Because I know a lot of my patients that come to me are like, hey, I was taking blah, 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 blah. And I'm like, yeah, well, that makes sense why your stomach is horribly inflamed. Let's work on it. Okay. Now, causes, I'm just going to do like simple cause. I put down 4 for us that are going to cause low stomach acid. The first one is going to be that infection we talked about, Helicobacter pylori. It suppresses your parietal cells' production of stomach acid. It kind of makes itself nice and cozy there because it cannot survive in a proper stomach acid environment. Next piece of it is going to be stress, right? And if you're listening to this and you're like, I don't have stress, then you are unbelievably spiritually gifted, or you're lying to yourself. We're all stressed, at least at some level, whether it's an excited stress, a eustress, or a distress, or we've got trauma from a childhood, or generational trauma that just keeps getting passed to us. It keeps popping up. We all have some level of stress is how we deal with it. Okay, the next one is going to be gluten. So gluten is also going to have an impact on those cells that produce stomach acid. And then alcohol doesn't necessarily cause low stomach acid, but just kind of ticks off the stomach. So I guess the top 3 would be the infection, so H. pylori, stress, and gluten. Those would be the main ones. Okay, and then don't drink if you have stomach issues. It's just common sense, really. What are some symptoms now? If you're like, well, how do I know I have low stomach acid? Well, this is going to go against popular belief. If you've got acid reflux, right? If you've got GERD, what? How does this happen? Let's go through the mechanics. Your body is smarter than 99.99999% of your doctors out there. Okay? Smarter than me, but I'm educating you to a level to get you to understand that your stomach's smart. Your body's smart. When your body eats food, okay, first off, if you have stomach issues, stomach inflammation, typically you're not going to be very hungry. Okay? Because your stomach's going to send a negative feedback loop up to the brain to say, hey, brain, tell Jacque, don't send any more food down here. I can't eat anymore. I can't break down this food. Every time we do, I'm uncomfortable. I'm tired. I'm inflamed. I've got this and blah, 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 right? Your body is smart. So say you do eat because you know, hey, I need to eat 5,000 calories a day if I want to gain weight, right? Right, man? So we start pounding this food and the body's like, whoa. I can't break this stuff down. So what happens? We get this belly swelling. We look like we're pregnant, men and women. We have like these food babies that take place. We're like, what in the world is going on? And then the stomach tries to contract and squeeze the food back up into the esophagus because it's like, get this shit out. I can't break this down. Get rid of it. Just throw it up. Like get rid of it. So what will happen is it's dragging up the stomach acid, right? Because if it's all contracting, then the gastric juices are going to be coming up and it's going to be burning around the esophagus where the esophagus drops into the stomach, okay? So if that's the case, we're going to have symptoms of acid reflux. We're going to have GERD. So when we're being told, take antacids, take stomach, reducing medications, take proton pump inhibitors, right? What is that doing? It's just leading us more towards death and despair. And we know the research now on proton pump inhibitors and what that's going to do to the brain. It can cause Alzheimer's, can cause all kinds of other damage in the body. And you're going to understand why when we can start talking about these things, but we always want to find that underlying cause. You will not find that at your standard doctor. Your standard doctor doesn't care. Your standard doctor is just going to give you a medication because it's quicker. It's just so much easier than trying to determine lifestyle factors that are going to impact somebody's gut. It's easier to just give you medication. We'll do surgery in 5 years when your stomach is completely a mess. So this is an example that I can segue into myself as well. My wife used to make fun of me. My patients all know this story of me too. So I had this infection, and so, I'm kind of a meathead at heart. I loved working out. And then we would go out and we'd get like a steak steak dinner, and like eat steak. I'm like, ooh, this is so good. Like, I love this, ready to go back home. And then my stomach would just be like, I'm like, oh, come on. Like, let's not do this tonight. Let's not do this tonight. Let's not do this tonight. And I'd go to bed, and I would always go to bed, rested on an incline, right? So the food would stay down. And this is like, as of like 5-6 years ago or so, probably 6 years ago now. And so I'm like, please stay down, please stay down, please stay down. And what would happen? I would wake up 2-3 o'clock in the morning and violently vomit all the food out that I just ate for dinner. And we'd be going to like nice steak houses, or my grandma would take us to the country club out by her. We'd eat some steak, and I'm like, get all this stuff in, like, this is good. And then sure enough, like clockwork, 2-3 o'clock in the morning, wake up, scream, vomit, come back to bed, have sweats, and be pissed off the next day. I mean, I would throw up blood. It was that bad, right? And I'm like, I have no idea what in the world is going on. When your body cannot produce stomach acid, you cannot break down the food, and you cannot sterilize the food. So harder to digest proteins like chicken eggs, or just eggs in general. So eggs, meats, steaks, chicken's a little bit easier. Fish is going to be the easiest to break down. But like these harder to digest proteins, typically it's going to be beef, venison, elk, wild game meat, those types of things. It's hard. So if our body can't do it, we're going to try to push it back up. We're going to try to get rid of it. Okay. So just bear with me here. So acid reflux, GERD, we can get gastric cancer, so actual stomach cancer due to low stomach acid, again, against popular belief. We can have no appetite like we talked about. We can have weight loss because we're not going to be eating typically, but we can also have weight gain as well, because then people will gorge and just eat a whole bunch of shitty food, a whole bunch of carbs, because carbs are easier to digest, right? Than a steak is going to be. You can eat 500, Tostitos chips or something and just mow through them, and then, oh, okay, I'm good, but you didn't get any protein in. So that's going to cause more weight gain, right? You're going to have lower sex drive. Men's going to have low testosterone. Women will too, but typically it's going to affect your testosterone. You're going to have bloat, and then you're going to have constant infections. So women are typically going to show up with recurring yeast infections, UTIs, etc. Because again, if we can't sterilize the food that's coming in, we're going to have more bacteria get pushed, and more bacteria, bad bacteria is going to overgrow within the gut. And even the good guys in the gut are going to be imbalanced due to the commensal overgrowth, or due to the opportunistic overgrowth that's going to be present. Right? The stool test will show that, but that's what I'm getting at here. Okay. So there's a lot of things that can happen, a lot of symptoms that can push out just due to stomach issues. Okay. So when we talk about the no appetite, we kind of touched on that, the weight loss piece, low testosterone, because you're not going to be absorbing vital nutrients. You can't absorb the protein. You can't absorb fats, break down fats properly. So you're just going to have very few building blocks to create hormones. And we're going to talk about this particular infection at H. pylori and how much the damage this stuff does to the body. And it's a running joke. I was talking to one of my coaching clients the other day, one of the docs I work with, and I was just looking up a study. I had a patient that was coming in for care. They're ready to sign up, and they did. I'm so happy that she's like ready to go on this. And she had a case of Raynaud's, and I had another patient too with Raynaud's. And so for those of you who don't know, I call it like the patriotic disease. Your fingers will go like red, white, and blue. You can look it up. But there's a specific infection, H. pylori, that can cause and trigger this particular infection. And so the one guy that I was working with, we killed the infection. He's been doing absolutely fantastic. His life has completely changed and transformed. And I'm going to invite him onto the podcast. He doesn't know it yet, but I'm going to invite him on to talk about his story. But his fingers were fine. Even when it dropped like -10 below, he did pretty good. He just needed a little extra blood support. I think all of us would. We gave him like some beetroot powder or like some nitric oxide support, helped with increase in circulation, but he didn't have any issues. This is the first winter in I don't know how long that he didn't have any issues. So this patient was coming in too, and I'm like, awesome. I'm just curious. And I'm like typing in H. pylori, Raynaud's, NCBI, and boom, study comes up. I'm like, oh, all right. And it was basically like, if you get rid of H. pylori, it gets rid of Raynaud's. I'm like, cool. But like, you can do that. It's really fun. Type in like H. pylori and cancer, NCBI. H. pylori infertility, H. pylori miscarriage, H. pylori vitamin deficiency, H. pylori low testosterone, like the running joke with Dr. Landy and myself, like my one client is like, what doesn't this infection do? Like, this thing does everything under the sun, and it's massively undiagnosed, right? So I've had patients like, oh, I've done breath tests, I've done tests in the hospital, I've done tests through myself or through my insurance, or I've had other docs test. I'm like, no. I'm like, you need this one. And again, I have no affiliation at all with GI Map. I just love their test, especially for this marker, because it tests for H. pylori and it tests for any virulence factors or any increase in intensity that would happen due to the infection. So if you have a higher risk of like gastric cancer, or if you have like BAB A or VAC A, I think is another one that's on a whole bunch of virulence factors. So not only do you see if you have the infection, but you see how aggressive the infection can and may be. So when we look at it, this infection absolutely causes stomach problems. It basically embeds itself in there, creates biofilms or like little roofs over their head and kind of like protects in there like a little bunker, has like a bunker over there, and it hides. It just keeps pumping toxins into the body. It is abusive to people. It'll cause infertility. It will cause Raynaud's. I've seen it trigger autoimmunity. I've seen it with cancers. I've seen it with Hodgkin's lymphoma, non-Hodgkin's lymphoma. I've seen it cause anemia. And anemia is always a fun one because I'll have people who are like just biohacking left and right. And you're like, I have done everything. I cannot get my iron up. I don't know what it is. I eat 5,000 pounds of red meat a week. Like, I can't get that up. And I'm like, cool. We run a stool test. Boom. You've got H. pylori. We fix H. pylori, and then their iron markers actually go higher. And we're like, okay, pump the brakes on the iron supplementation. Let's just get you back to normal. Let's get that digestion back to normal. Okay, so that's huge. And then what else can it do? So this is something that a lot of people don't know about, but it will reduce your vitamin C. So if it reduces vitamin C is vital to the body, not just for the immune aspect of it, but it helps with cartilaginous regrowth. So it helps with tissue repair, injury repair, obviously energy, and it's also very, very, very important for your adrenals. So if we don't have vitamin C, we're going to be deficient. We're not going to have scurvy or anything. But I guess that would be a risk if you continue on this path. But you get low vitamin C and then low vitamin A. So low vitamin A goes back to like the skin, right? So vitamin A, vitamin E, these types of things are really great for nourishing and having healthy skin. And if we don't have them, then things like acne, breakouts, rashes, and things like that I've seen H. pylori cause can also pop up their ugly head. It also causes low B12. Okay, so B12 deficiency causes pernicious anemia, causes low folic acid or low folate, right? So if you stack in the fact that you have MTHFR, which is where you need methyl donors, you need folate, you need all these healthy things, and you stack in H. pylori, you're basically just butting heads against each other. And you're like, well, I've got this infection. I know what I need, but I don't have this. And so, yeah, well, there we go. That's what I had, right? So I had 2 active genes for MTHFR, and I had H. pylori, and I had virulence factors. So I had the world stacked against me. So again, this is where I speak from testimony for myself, is like this particular infection, when you eliminate this thing, like it will absolutely open up your eyes to how much potential you truly have. And again, because 50% or at least 50%, I'll say at least because you don't test everybody every day. It's like your yearly physical does not require you to get tested for H. pylori. And then this is medical testing. So I've seen their tests. Their tests suck. So I would probably err more towards at least 3/4 of the population has H. pylori. And for patients who are coming in to see me, healthy or incredibly unhealthy, I would say at least 95% of my stool tests that come back have this particular infection. So for my own clinical case studies, if I gathered everything up, I'd say 95% of the population, due to my amount of people that I've had, you could extrapolate it, but about 95% of the population I would feel has this particular infection. It's just whether or not they have symptoms of it or not. And already the 50% average for the medical community and 20% having symptoms, that's pretty intense, right? So when we have this floating around, this mystery infection, it's impossible for us to be healthy, right? It's going to cause everything to go wrong within the body. And so we have GI specialists that are going down and treating the gut. We have people trying to understand SIBO and SIFO, so small intestinal bacterial overgrowth or fungal overgrowth. We've got colon specialists. We're like, oh, let's cut out some polyps. Let's work somewhere. Like, everyone seems to be missing the stomach, which is why I love it so much. Like this needs so much TLC, right? So we have to make sure that when we recognize, hey, our stomach is probably going to be the main driver of why we have things going wrong. Now, you'll find influencers all over the damn place trying to promote, just take this, just take that, just take this, just take that. And they're a bunch of freaking morons. Find that underlying cause, right? And then assess your stress. Make sure that you're doing things that are appropriate for you and aren't hurting you, okay? Because again, I could sell anybody betaine HCl. Oh, you need betaine. That will increase your stomach acid. Cool. And then I'd get a bunch of hate back being like, hey, I took betaine and my stomach felt like it was on fire. Or this hurt so bad, or I hate this, and this did not work. It's like fighting with a 4-year-old kid. It's like, I don't like this. Well, you bought it. Like, I guess I could have found out the underlying cause of it. That's what people are pushing. And I'm tired of these little patch repairs for supplements, because this isn't a place where you should just be fucking around. You need to understand what is going on in your gut. If you don't, you are a consumer of that particular pill, potion, lotion for the rest of your life, whether it's medication or whether it's holistic. And to me, that is a disservice to you, right? We take these enzymes. People are like, we need enzymes. And don't get me wrong, enzymes are great if you can't produce them. But what people don't understand, because these holistic people are not teaching you, is that the enzyme blends that are being created are to try and match the enzymes that your body naturally creates. So therefore, if your body cannot create the naturally occurring enzymes that the body's supposed to be able to create, why might that be? Right? So you shouldn't need digestive enzymes for the rest of your life. And if you take enzymes, like I feel great, then that lets you know that your body has currently been incapable of producing their own enzymes. So what should you do? Run a stool analysis, work on the stomach, figure out what you need to add in and what you need to eliminate from your diet, from your lifestyle, from your supplementation routine to get your stomach acid back on track. So let's go through this. So what do you do? Number one, stop taking antacids. Just stop it. Just stop it. That's like one of the worst medications you could possibly take is these antacids, Tums and things. Just stop. Okay? The other thing is going to be your NSAIDs, non-steroidal anti-inflammatories. Right? We take pain. I had a patient who was taking painkillers, we'll just call them painkillers, taking painkillers because of the infection that they had in the body, in the stomach, and in the body. There's a C. diff and there was an H. pylori infection, and they were saying that there was pain, so they were taking painkillers, which was then intensifying the H. pylori and that particular C. diff infection, because C. diff loves to grow when you take NSAIDs, and it was creating this vicious cycle. Right? You're treating pain, but causing pain. Treating pain, causing pain. Treating pain, causing pain. So when you're taking antacids, treating pain, causing pain. Treating pain, causing pain. Stop that cycle. Right? You're doing the definition of insanity, doing the same thing over and over again, expecting a different result. You're not going to get a different result. It's always going to be the same. It's always going to be predictable, if not worse than when you originally started it. Okay? Spraying over a check engine light is not the answer, especially when it comes to the GI tract. Everything you put in your body has to go through the GI tract before it goes anywhere else. Anywhere else. So say you are taking $1,000 a month in really expensive supplements, right? But your stomach acid's terrible. How is your body going to absorb those really expensive supplements? Not very well. The bioavailability of them are going to drop drastically. So you may be spending $1,000, but your body may only be consuming $200 worth of it because your body can't break it down. The pills are too much, or it's too difficult for your stomach acid that's not there to break down these pills for you. Okay, same thing with medications. You drop in medications in the body. You start working on the stomach acid, you can absorb more of that medication. You can decide for yourself whether that's a good thing or a bad thing. But it's an important thing for you to know, for you to be aware of. So stop with the antacids, stop with the NSAIDs, stop with the painkillers. Antihistamines are another one. So antihistamines are going to be caused due to typically stomach issues, liver issues can cause it too, which is going to come from GI tract. And if we have certain bacterial overgrowth, right? So if you're taking antihistamines, you're causing this problem to consistently occur. There's salts and things like that you can take. There's a product called Histaese. There's quercetin. There's nettles. All that stuff has a natural antihistamine impact without causing further suppression of your stomach acid. So that's an easier, healthier alternative. Calcium channel blockers are another one that's going to cause issues. We talked about proton pump inhibitors. Antibiotics are going to cause massive dysfunction, which is typically how the medical community treats H. pylori, is with 4 antibiotics. They try to bomb the gut and never retest afterwards. Never. You can suppress and quiet down the infection. Then you go through a stress state, you go through divorce or a loss or financial stress, and all of a sudden, H. pylori is like, I'm back. Like that's what happens. Cholesterol medications will do it. Chemo is another one that will cause massive stomach dysfunction. I've seen this all too often where people will go in. I had a girl who had some cancer. I won't say exactly what it was. She had a pretty aggressive cancer. She went and got chemo treatments and things. We tested her afterwards. We found out she had a bunch of opportunistic infections. We worked on the stomach acid. It took us some time to get the body to wake back up again. Now she's got a beautiful full set of hair. She's phenomenal. She's got tons of energy to the point where her parents are like, can we hit her with a tranquilizer dart? Like this is just getting absurd at this point, right? So a lot of these things are going to be causes of what are going to trigger low stomach acid and stomach acid complaints or stomach complaints, right? The other thing too is work on the stress, work on your sleep, work on what you put in your body, nourish the body, don't destroy the body out of ease, okay? What should you do? Number one, get tested, assess your stomach acid function. If you do the GI map on your own, or if you buy it from the store, you're like, how do I assess? Look for Helicobacter pylori on page 2. And then you can look down on the last page. I believe it's page 5 now because they separated it. Page 5, there's going to be a marker right below steatocrit called elastase 1. That'll typically show you whether or not your stomach acid is up to snuff or not. If you look at page 3, you'll see a bunch of opportunistic overgrowths. If those are high, so if you have H. pylori, bunch of opportunistic overgrowths, low elastase, lower than 750, you're typically in a state of hypochlorhydria. So that would be an easy way to assess if you just wanted to learn on your own. So you would eliminate the H. pylori infection, do the removal phase, and afterwards work on bringing in and introducing betaine or digestive enzymes to help to bring up that stomach acid so that H. pylori doesn't come back again. Okay? You can take enzymes, and this is controversial, but I'll say take enzymes that do not have betaine in them. If you take betaine while you have an H. pylori infection, your stomach is going to be so mad. Also, don't take betaine if you have ulcers, stomach ulcers. There's times where I've had patients who have had stomach ulcers in the past or come to me with stomach ulcers. We'll kill H. pylori, heal the stomach, and we'll put them on betaine. You use a clinician for that. You have to be really careful with the dosing. There's a strategy behind it, but it's not impossible to bring your stomach acid back up and heal the gut lining so you don't have the ulcers in your stomach anymore. We've had probes and stuff sent down, analyzations, and the ulcers are totally gone. So you have to do it properly and appropriately. So long story short, be careful with betaine. Okay. Apple cider vinegar, great thing to take before your meals. It starts to get the digestive juices flowing. Same thing with herbal bitters. Mountain Rose Herbs is a great company that you can order from. They have a little tincture of herbal bitters. You can find all kinds of stuff out there. You can use ginger too. So ginger root's really great, really soothing for the stomach. And then what do you need? So what do you need for stomach acid? And this is interesting, right? So you need B12, you need folate, and you need zinc. Those are 3 nutrients that are basically deprived from you when you have H. pylori, right? So again, recycling all this information. How do you get the stomach back on track? Make sure you do a full over analysis. Look at the price of the GI map. If you don't have the money right now, I promise you save up for it. And this is one of the things I do for my yearly physicals. I'll run a new GI map on myself to see how my gut is doing. Because to me, the gut is where it's at. The gut is the most important set of organ systems in the body. And that's what I'll take that to the bank. I'll take that to the grave. So anyways, long story short, on this entire conversation, one of the most overlooked, underdiagnosed, so overlooked, underdiagnosed, and overtreated areas of the body is by far going to be the stomach. If you can fully focus and you fully analyze the stomach and get that corrected, a lot of your other GI complaints are going to either completely go away or they're going to be massively improved. So the choice is up to you. What do you want to do with this information? Do you want to think about it? Do you want to research it? Have fun with that H. pylori research. Just type in NCBI, right, or PubMed. You'll get tons of literature on this stuff. Okay? Learn more about this. Learn more about your body, because at the end of the day, I've said it 1,000 times, you have to be your own health advocate. And as far as I've been able to see, nobody's talking about the true underlying cause of stomach issues besides me. And that's not even like tooting my own horn. I don't understand why docs aren't talking more about stomach acid, right? So if we correct these things, or if you're able to correct these things, even if by yourself, your body will function, it will operate, it will be so much better than when you started. So take this information for what it is. I love y'all. Thank you for tuning in, and don't ever settle for being ordinary.